Flexation, a joint movement that in most cases decreases the angle between two bones. The joint type is synovial joint. The bones involved in this movement are humerus, radius, and ulna, and the muscles are brachii, brachialis, brachioradialis, and the biceps and triceps. Extension is a movement that straightens a joint and returns a body part to the zero position. The joint type is synovial joint. The bones involved are the femur, tibia, and patella. The muscles are rectus formis, vastus lateralis, vastus intermedius, vastus medialis, articularis giner. Adduction is a movement of a body part away from the median plane, as in raising an arm away from the side of the body. The joint type is synovial ball and socket. The bones involved are the femur and the pelvis. Muscles are adductor brevis, longus magnus, and gracilis. Abduction is a movement of a body part away from the median plane, as in raising an arm from the side of the body. The joint type is the ball and socket joint. The bones involved are the pelvis and the head of the femur. The muscles are the gluteus medius, gluteus minimus, and tensor fascia. A joint movement in which one end of an appendage remains relatively stationary and the other end is moved in a circle is called circumduction. The joint type is ball and socket, and the bones used are the humerus and the scapula. The muscles involved are the supraspinatus, the infraspinatus, and the subscapularis. A foot movement where the toes are moved to somewhat face each other is called inversion. The joint type is the subtalar joint. The bones used in this movement are the talus and the calcaneus. The muscles involved are the tibialis anterior and posterior. Eversion is a movement where the soles of the feet are turned to face outward. The joint type is the subtalar joint. The bones included in this movement are the talus and the calcaneus. The muscles involved are the tibialis anterior and posterior, as well as the fibularis longus and brevis. A rotational movement of the forearm that turns the palm downward or posteriorly is pronation. The joint type is the pivot joint. The bones involved in this movement are the radius and the ulna. The muscles involved are the pronator teres, pronator quadratus, flexor, and the carpi radialis. A rotational movement of the forearm that turns the palm so that it faces upward or forward is subnation. The joint type is pivot joint. The bones involved in this movement are the radius and the ulna. The muscles are the supinator muscle, biceps, brachii, and brachioradialis. In the frontal plane, a body part is raised vertically. This is called elevation. The joint type is a synovial saddle. The bones involved in this movement are the clavicle, scapula, and humerus. The muscles are the traps and the deltoids. Depression is also in the frontal plane of the body, and it's when a body part is lowered. The joint type is the synovial saddle, and the bones involved in this movement are the scapula. The muscles are the latissimus dorsi, serratus anterior, pectoralis major and minor, and the traps. Moving in a way that you are positioning something near or close to each other is opposition. The joint type is the synovial saddle. The bones involved in this movement are the trapezium bone and flexor retinaculum. The muscles involved are the opponens pollicis.